Hello, my name is Emily Vang, and I am an RN, and I am currently a student at the College of St. Scholastica in the Doctorate of Nursing program, pursuing my family in nurse practitioner. Today, I'm going to be talking about health exchange information systems. Let's get started. So, what are health information exchange systems, or e-health exchange? Health information exchange systems allow providers to look up medical information about mutual clients within lots of different healthcare systems. Participating organizations must agree to follow certain standards, which enable them a secure and integrated connection between all participants. E-health exchange is a type or like a brand of health information exchange system. E-health exchange provides healthcare organizations a single connection and a trusted framework to exchange patient medical data nationwide. This is important because it allows for providers across the nation to access information regarding patients' medical data. The Federal Trusted Exchange Framework and Common Agreement, or TEFCA, is up and coming, and this aims to reduce fragmentation of patient records by expanding query-based health information exchange with nationwide connectivity. So by having a large health information exchange system nationwide, they're able to reduce that fragmentation of the patient records. So a portion of it isn't at, hospital A, and then this portion's at hospital B, but hospital A puts it into the HIE system and hospital B puts it in, and hospital A and hospital B can see everything. Benefits of health information exchange systems. The main benefits are improved speed, quality, safety, and cost of patient care. I found a study by Sloan and several others done in 2023, wherein they took about 8,200 hospital patients over the age of 18 years old, and they looked at them. These patients were discharged from January 1st, 2021 through November 30th, 2021. They used the Paso del Norte Health Information Exchange System in El Paso County, Texas. All of these patients that they studied had a primary care physician visit within 30 days following their hospital discharge. This study identified patients that were looked up in that HIE system close to that follow-up visit with their primary care provider. During the follow-up window, they found that 2,600 patients were rehospitalized, 3,800 visited an emergency room again, and the remaining 1,700 patients were controls. So what does all this mean? Well, it means that they found that patients that were associated with that lookup in the HIE had a significant reduction in the likelihood of visiting the ED by 53%, and by being rehospitalized by 61%. So those patients that their primary doctor looked up their medical record information in the HIE following the hospitalization, they were able to address any gaps in care. They were able to see all of the lab work, the radiology and everything, which helped to improve patient care and reduce significantly their likelihood of going back to the ED or being rehospitalized. Positive patient outcomes and HIE systems. HIE systems provide a vehicle for improving quality and safety of patient care by reducing medication and treatment errors. They stimulate consumer education and patient involvement in their own healthcare, meaning patients have access to all of their healthcare information in that single database, just like the providers do. And so they're not having to keep track of all of their paperwork and all of their logins for all of the different healthcare systems they're a part of. They're able to look in one place and get all of their information. HIE systems increase efficiency by eliminating unnecessary paperwork. So little Ethel doesn't have to fill out the same thing at Dr. A's and at Dr. B's and at Dr. C's. Now that thing or that paperwork has been filled out and entered into the HIE, and now she doesn't need to fill it out 2 or 3 other times because all of the providers have access to that paperwork. HIE systems provide caregivers with clinical decision support tools at the click of a button, which is better for more effective care and treatment. HIE systems eliminate redundant or unnecessary testing. So if Ethel had a blood test at the hospital and she goes to her follow-up appointment, the doctor has access in the HIE to those results and doesn't need to do the same lab or the same blood draw. HIE systems improve public health reporting and monitoring because all of the information is in one database, and so it's easy to run queries and retrieve data. They also create a potential loop for feedback between health-related research and actual practice. So instead of studies being just in a lab or based off of different papers or data, they're actually able to take real live data from actually practicing providers, take that data and then create studies and better associate their research with what's actually occurring out in the field. HIE systems facilitate efficient deployment of emerging technology. They provide a basic level of interoperability among health records or electronic health records. So the electronic health records will have to have certain infrastructure in their coding to be used in that HIE system, which will make more standardization across health records and will make it easier in the future for us to have even more efficient health information exchange systems. They also reduce health-related costs. Healthcare equity and HIE systems. Vidya, I think, or Vidya said healthcare information exchanges could provide the missing link between providers, payers, and community-based organizations working to address social detriments of health. So how do they do that? They do that by improving information exchange between different specialists in healthcare systems. HIEs are able to improve patient access to their information. They're able to improve communication between all providers and the patient, and improve identification of trends or gaps in care for certain populations throughout all healthcare systems. All of these things can be used to improve healthcare equity and to address social detriments of health. Appropriate and timely sharing of patient information will help improve decision-making at the point of care and allow providers to avoid readmissions, as we saw in that Sloan study, avoid medication errors, improve diagnosis accuracy, and decrease duplicate testing. In conclusion, the use of HIE systems has been shown to improve patient outcomes across various healthcare settings. Their information is valuable in measuring healthcare data and can be used for research and further improvement of healthcare. By participating in an HIE system, such as eHealth Exchange, providers can reduce cost of healthcare, reduce medical errors, and improve quality, safety, and efficiency of healthcare. Here are my references. Thank you so much for your time. I hope you have a great rest of your day. Thank you.